Welcome again for our health segment with Perpetue Robert, Naturopath. We know that we meet every day, weekday at 6 p.m. and in English, and in the morning we are there at 12. So come join and let's chat and learn about your microbiome. Every month so we basically have a new subject. Okay, we basically have a new subject, and I try to really teach you first, and then give you some advice. At the meanwhile, let me share in the group. So if you are there, if it's the first time you are with us, so you are so welcome. I'm really happy that you might join the live, and I'm asking you to ask question, share the link if you can. And if this is not the first time, welcome back. And let's continue to get our health out of hell. And if you haven't joined the group yet, so please do so. Okay, so if you are there and you have any problem, like any kind of problem, you might stay there, ask questions, I'll answer you. Okay, so but today we're gonna talk about still the microbiome. Microbiome is the microorganisms that are living within you, is like bacteria, viruses, candidas, and all those microorganisms that are in us and that we don't see them, right? And right now it's everybody's like, when they hear bacteria, everybody's like scared, but you have to understand there is good bacteria also. There is a bacteria that are living with you, and you have to be in harmony with them. You have to live, you have to help them, in fact, because if you do not do that, what's gonna happen is they will die, or they will be overgrown. The good one will die eventually, or the bad one will be overgrown. And when they overgrown, what's happened? There is sickness, inflammation, and so on. And that's why today we're gonna talk about our bones and joints, because when there is an imbalance called dysbiosis, that means there is not a balance between all those bacteria. They might affect your bones and joints. So that's why we have rheumatoid arthritis. Okay, rheumatoid arthritis is an autoimmune disease that can give you so many different problems. You have like inflammation in your joints. It's chronic inflammation, and you have a different articulation. You have different joints that will attack your hands. Sometimes you can see people's hand, they are really, they start having this formation in their hands and their feet. Some are really worse than the others, but it's still that their joints are not there. And people that have rheumatoid arthritis, they have a lot of pain, and sometimes they have inflammation in their articulation also, and sometimes they just feel like, oh my goodness, I can't really move my hands, or I can't really move my feet. I don't know what's happened. Those are early symptoms of rheumatoid arthritis. Okay, so like, sometimes when you wake up in the morning, you feel like, oh my goodness, my hand, it's hurting. You keep doing that and feel like the pain will gone, and eventually it's not gone. You have your whole body starting to react and having pain in different articulation, in different joints. Okay, so what it can do, it can be progressive also. It can be progressive. That means it start one point and then it continue. But sometimes it's genetic, but sometimes, not every time is genetic, but a lot of time is genetic. And what they find out that's an imbalance in the gut microbiome, in the intestinal area and mouth. And mouth. Okay, so when those microbiome are in balance, So people have those problems. So, but you have to understand, when we talk about the gut microbiome, it's like 100,000 billion of microorganisms that are living in the gut area. 100,000 microorganisms are living there. So that's mean there are a lot. And in the mouth area, it is 700 species of bacteria that are living in the mouth. So that means they are really, really important. And because they are that important, any kind of imbalance that happen to them is going to affect the whole body. Gonna affect the whole body. That's the case for the rheumatoid, arthritis rheumatoid. Okay, that is the case of it. And like I said, it's not mostly, it is genetic sometimes, but some of the time it's not genetic at all. And the other ones that we have that affect the body is lupus. Lupus is becoming so common. A lot of people are having lupus. And in fact, I have young client, 15 years old client that's had a lupus. Can you imagine that? Lupus. You know, some kind of sickness that used to be only old people, but now in nowadays we have young people having them. We have young people that are suffering with problems that only old people used to have. Why is that? Because of the quality of the food that we are eating, because of the stress that is everywhere. Okay, and also more and more children, more and more youth now, it's really stressed to perform. It's really stressed to give the best. They want to be on top. They want to be, you know, perfect in every single thing. And sometimes we parents, we think we are doing good. We are pushing those kids, pushing, and then in fact it's just in fact it's not helping them in terms of health. Okay, I'm not saying not pushing your children. No, that's not what I'm saying. I'm saying that really wanted those children to achieve perfection sometimes has a problem in their mental well-being. Okay, so lupus is an autoimmune disease and it's affected the immune system. Okay, so what's happened? The body, you know, is producing antibody. Okay, that's why now you're gonna have inflammation, and there is sometimes it's gonna touch tissue, different kind of tissue in the body. So there is so many symptoms in this problem in lupus. We have fatigue, we have people that have skin problem, we have people that have joint pain, we have people that have dry eyes, dryness in the eyes. Okay, some people their hair will fall, some people will have fever, some people will have lungs problem, some people will have heart problem with lupus. Yes, it can definitely attack different area of your body, of your organs, and those organs are vital organs. And people that are suffering with lupus, they are in pain. Especially when they have crisis, they are in pain. They are in pain. So what they find out, okay, is that when there is an kind of imbalance in the microbiota in patients that have lupus, they notice that. So that means microbiota is really, really important. Those microorganisms are really, really important. So, and those are the microorganisms that start to do antibody. Okay. And another kind of problem that they realize is arteriosclerosis. Arteriosclerosis is like you have, basically it's kind of cholesterol or fat, we can say that kind of cholesterol that attach itself to on the arteries. And sometimes, so it's really the way for the blood to circulate become really small, and sometimes become so small that is basically block the blood flow. Okay, it block the blood vessel, and when that's happened, if it's in your heart, you know, you might die, you might have a stroke, you might have you might have a problem with your lung, difficulty breathing, and you might pass out. You can basically die of cardiac arrest. So in 2000, they make studies about that, and they find that, listen to that, okay? Listen to that. That's from arteriosclerosis. You will think that. I will ever think that. That's from arteriosclerosis, that's microbiome in the gut and microbiome in the gut contribute to the instability of those cholesterol, you know, those things that is in our arteries. So when they break out, those block of cholesterol, when they break out, what's happened? One of them can go to your brain, and you can have a stroke, or it can go to your heart, and you have a heart attack. Okay, and especially if you, not only that your microbiome is well unbalanced, but when the diet that you have is rich with fat, that's what's happened. Diet with fat increase the problem of arteriosclerosis. So, and what they do, and they find out that the bacteria play really an important, the bacteria play an important role in the endothelial cells in our cell. And follow that invasion, those cells activate themselves, and what they do, they make that they have more cells, you know, that will gonna stuck in the arteries. Yeah, and what's happened is gonna have a lot of inflammation. So those cells usually are associated with a rich diet, a diet full with fat, and a diet, because of the diet that is fully fat, that's why it's like basically make the cholesterol that you have in your artery become more and more. Okay, those are those three things that really when you have an imbalance microbiota, an imbalance of not only the intestinal gut, but also in your mouth. And we remember that in your mouth, we said whenever we have a problem, like for example teeth bleeding or gums problem, and you are really at risk of problem autoimmune disease, and especially lupus and rheumatoid arthritis. So guys, take care really of your gut bacteria, and take care also of your mouth bacteria. Generally, when you take care of your gut bacteria and they are really well balanced, we talk about having a gut that is rich in different kind of bacteria. And how can you have it? Is when you are eating diverse quality of food. The diverse quality of food that you have will help that you have a diverse variety of microorganisms that are living in you. Okay. So if you have any question, please feel free to reach out to me in the comment section, or I'm gonna put my link that you can take a free 15 minutes of free consultation, where we can sit down to see how I can help you really take good care of you. Okay, so let me know if you have any question. And that was really a sweet and short one. So see you tomorrow at 6 p.m.